The federal government looks at the upside of COVID-19 in Nigeria, as almost 4,000 persons have been treated and discharged in the last 100 days, just as the Minister of Health releases report on mysterious deaths in Kano State. The national coordinator of the PTA reels out new guidelines for Nigerian evacuees. And in the United States, New York officially begins its first phase of reopening. It's past 100 days since the first case of COVID-19 was recorded in Nigeria, and the Director General of the Nigeria Center for Disease Control believes that Nigerians are getting more informed and better prepared. He was speaking at the Presidential Task Force briefing in Abuja today. Ogochikwe Igekwazu explains that more focus will now be on public health teams across the state. The NCDC boss highlighted the need to have better data collection and the establishment of laboratories at the state level.
Now, like you know, we're going to have to focus a lot of our response over the next few weeks on the states. And the set of professionals that work in every state that have had to take on a lot more responsibility. They're called the state epidemiologists and their teams. State disease surveillance and notification officers also exist at the local governments, but they're all coordinated at the states. In many states, there are also the incident managers of the emergency operations centers, and they are the heart of our collaboration with the state. But also there are a few opportunities coming their way to support the work that we're doing. We're looking for resources wherever possible to make their life easier. And one thing that we must get out of this outbreak is really to build a network around them. So very often in the past, they have not really been recognized in their responsibility in the work that they're doing on all our behalfs. But in effect, to do that work effectively, they need the resources. So it is really, they are the first people we call when we hear there's a case of X or Y, or there's a cluster of unknown illness or unknown deaths. Our first response is always to call the state epidemiologists. And very often they don't have the resources to go into the rural areas to go and investigate these things. So we're looking for various opportunities, and there are some opportunities in the horizons to support them to be able to do their work better. But critically, we've also been advocating to the state governors.
Meanwhile, Nigerians waiting to be evacuated from countries across the world will now have to meet certain conditions for their pickup. Some of these conditions include the pre- and post-COVID-19 testing and must be responsible for their stay in Lagos or Abuja. The national coordinator for the Presidential Task Force on COVID-19, Dr. Sani Aliu, explains that the new protocols for evacuation of over 4,000 Nigerians abroad at the briefing today.
There will be a need for Nigerians that are currently outside the country to undergo a PCR test for COVID-19 before they board. These tests need to be valid at least for 14 days. In other words, if the test is done beyond 14 days, then it will not be accepted. And prior to boarding, they will be required to provide an undertaking that they will follow the necessary precautions that we have applied when they come into country. This will include the need for them to make themselves available for a repeat PCR test in country when they arrive within 72 hours. They will be given an appointment card and an address where they will go and have the test done. They would also be required to stay in the points of entry. This will be Lagos and Abuja for now, because these are the two cities where the flights will be coming in, and these are the arrangements we've done with the private sector. They will need to stay in Abuja or Lagos and make arrangements for their own accommodation in these two cities for the period of 14 days. The main difference, we will not be responsible for the transportation or the accommodation of Nigerians coming in. They will need to make their own alternative arrangements to stay in Lagos or Abuja, not only for the period of testing, but also for the period of self-isolation. But they can, if they wish, stay at home, provided they undergo self-isolation at home.
Still at the PTF's briefing today, the Minister of Health, Dr. Osagi Haniwe, gave an account of the unusual deaths in Kano State. He explained that about 50 to 60% of those deaths witnessed in the state in April are COVID-related fatalities. He also spoke on the cases management since the first confirmed case of COVID-19 in Nigeria.
In these 100 days, we have tested over 76,800 persons, recorded 12,486 confirmed COVID-19 cases in 35 states and the Federal Capital Territory, successfully treated and discharged 3,959 persons, but sadly lost 354 Nigerians, most of whom had underlying illnesses. With regard to the unexplained deaths in Kano, which occurred in April over a 5-week period, the team confirmed that a total of 979 deaths were actually recorded in 8 municipal local government areas in the state, and at a time at a rate of 43 deaths per day, as measured by counting activities at the graveyards. The peak was in the second week of April, and by the end of April, the numbers had started to reduce and had finally now settled at 11 deaths per day.
And from Abuja, let's head to Abia State, where the governor, Okezie Ikpeazu, has joined the League of Governors that have tested positive for the COVID-19 in the country. The governor was said to have volunteered his sample for test on May the 30th after 2 of his aides were diagnosed with the virus. On June the 2nd, the governor's result returned negative. Not convinced about his status, the governor submitted another sample to the NCDC laboratory on June the 4th for further confirmation, and the result returned positive. Meanwhile, the governor has gone into isolation in line with the NCDC protocol, and he is being managed by a team of medical practitioners. He's also directed his deputy, Mr. Ude Chukwu, to act on his behalf pending his resumption of duties. And in Bauchi, the Deputy Governor, Balatella, is another high-profile Nigerian also currently receiving treatment for COVID-19. Our correspondent, Hajara Liu, brings us updates on this and other happenings around COVID-19 in Bauchi State. Hajara.
Bauchi State has yet again seen an increase in daily numbers of confirmed cases of the coronavirus in the state. Yesterday, a double-digit case was recorded, 10 newly confirmed cases after over 3 weeks of recording only a single digit a day. This brings to total 256 the number of confirmed cases of the coronavirus in the state, with a 3.1 fatality rate, all males 50 years and above. We have been told that the deputy governor who tested positive for the coronavirus few days ago is responding to treatment after showing symptoms of cough and fever. He was the chairman of the COVID-19 task force before he took ill. We understand now that the Commissioner of Health, Dr. Aliu Megoro, may serve in his capacity until he recovers. The COVID-19 pandemic has crippled businesses, no doubt, and hotel owners have cried out through their national president, Eze Patrick Anyanwu, and they said that matters have been made worse, especially with the interstate travel ban in place.
People not coming from various states, we cannot call ourselves hoteliers, because when you come a hotel of this nature, having about 50 rooms. You come, you see only one person or two. It's like there's no business. And time will come, they will still ask, NEPA will come and ask his own this thing. Revenue people will come, both federal, state, local governments. They will come. And there's no way you can run away from it. And many of our members borrowed money from the bank.
As more sectors are expected to reopening in the days to come, it is also expected that all arrangements, plans, and strategies have been put in place in order to minimize risk. From Bauchi State, Hajara Aliyu for COVID-19 updates.
Thank you, Hajara. And as the rising cases of the coronavirus infection continue to put a strain on Nigeria's health system, a new national interim guideline for the clinical management of COVID-19 in the country has been modified, and how cases are to be handled in the face of the active community transmission of this disease. The interim guidelines capture the classification of patients, diagnosis, management of complications, and discharge criteria for this. Let's quickly focus on the discharge criteria for the COVID-19 patient. According to the new guidelines, a symptomatic patient should be discharged by the managing clinician 10 days after symptom onset, plus at least 3 days without symptoms, while asymptomatic patients should be discharged from the COVID-19 pathway 14 days after the initial positive result, that's the date of collection of the sample. Also note that a negative laboratory test is no longer required to discharge a COVID-19 patient. But what does this mean in the fight against COVID-19 in Nigeria? I'm now being joined in the studio by a public health physician, Dr. Ayo Oluwole. Thank you for joining us.
Thank you, Nita.
This new guidelines that have just been put forward, what do you think is that what's required now?
Oh, so thank you. I feel that, as we all know, that COVID-19 is an evolving disease condition, and we continue to see how this is spanned out as we continue to see over thousands of cases that we have seen since the first day that it was introduced in the country. And so this has necessitated, and of course with WHO guidelines and technical support, has necessitated this new turn in our protocol for management. We know that if someone is infected with the virus, it takes about 3 to 8 days, okay, for some manifestation of the virus. And then we know that transmission is at best at this point in time when someone develops symptoms. So when someone is asymptomatic throughout the period but was tested positive, it is assumed, and of course with evidences we've found, that it's unlikely that this person is at the peak of transmission of the virus. And indeed, this person may have had some remission after 14 days.
Okay, so it's a little over 100 days since the first case was confirmed in Nigeria. Yes. But the country's response, now, between then and now, we've had positive laboratory network increase from 2 to 30. Yes. We had negative about 5,000 births to over 8,000 active cases. Would you say it's a product of the response pattern, the way Nigeria responded to this?
Yes, at the beginning of the pandemic, at the beginning of the response, you know that we've sat here to discuss that we can only find what we search for, okay? And I think we know, okay, that there might be a lot more persons in the community, as was evidenced by the admission that there was now a large community transmission at the time, that if we had intensified or ramped up our testing, which in any case we still need to continue to do, we will find cases amongst the population. So we are seeing the results of having to have moved from 3 or 2 centers in the country to 30. And hopefully, if we continue in this path and we're able to at least put a testing center in a state, for instance, we will find that we will still get more numbers, okay?
So,
and hopefully, of course, hopefully we might get new numbers, but hopefully if we also, on the other side, follow protocols and guidelines of prevention, we might have a downturn or flattening of the curve.
Okay, so far, 777,000 people have been tested in a little over 100 days. You're saying that if we have...
74,000, you mean?
77.
77,000, yeah.
70, over 76.
Yes.
We found out like 77,000 have been tested so far.
Yes.
But let's look at the case in Kano, for instance, where verbal autopsy said that between 50 to 60% of those deaths we're hearing about 937 people were COVID-related. Is it a testing site there, a testing location there that will make it easier to manage the situation?
Okay, so there were some, as we know, there were some delay in seeking for help at that time. You know that there was a peak around April, and then you find that there was some delay. This, and of course, with the culture of burying of persons who had passed on in those areas, it was difficult to, at the early phase, to determine what was caused. It was when people who were burial specialists that were burying cases and they saw that the numbers had increased, that was when it blew off. Okay, so we know that if there had been some response before then, okay, and there had been some guidelines that have been followed before them, we might not have seen what we saw. Of course, that has changed, and you see the Honorable Minister telling us that there seems to be some stabilization following interventions by technical partners in the state.
But those mysterious deaths are also happening in places like Yobe State, for instance. Would you say it's the same thing?
It might be the same pattern. It might be the same pattern. Like the Honorable Minister said, 60% of these cases were found to be COVID-19 related. Okay, so some deaths occur in the community. People who do not have access to go to the health facility, who have all other disease conditions, as we found every part of the country, have also died at this period, okay, and are not directly linked to COVID itself. But looking at the large number of persons who had died around this time, and then the lack of intervention at that point, it is safe to say, and of course with the technical partners who have joined in investigating these deaths, come up to that, and hopefully we will not have this situation again in the country.
Hopefully, indeed. The NCDC DG talked about more focus on the states and how they are managing the situation. But we'll look at the NCDC numbers when we come back from this short break. Do stay with us. Thank you for staying with us, our special COVID-19 studio update. Now, before we went on that break, we were speaking with Dr. Ayo Oluwole, and we talked about the fact that the NCDC DG said that going forward, the focus will now be on the state. The state epidemiologists need to get up and get into the SAC if they've not already been doing that, but they have to increase their participation and involvement. But all over, we're having the eased lockdown. Yet the chairman of that task force says Nigerians are still susceptible. From your point of view, what do you think the states might need to do to ensure that the spread is minimized?
Yes, thank you. I think that this was long overdue to have decentralized the response to the states. And I totally would understand that we never had this large situation that was almost overwhelming, because at the time it was overwhelming for the NCDC also. You look at the laboratory and you heard the Honorable Minister talk about the capacity for the laboratorians, okay? So they've gotten from a 2-lab situation to a 30-lab, and how to fill that up was a challenge. So in going back to the states, yes, I believe that the states at this point would also need to continue to build capacity, human capacity, infrastructure capacity. And this on the long run is going to help each state, okay, as we go on. We know that eventually as data managers have said, we might have to look at the situation where COVID-19 stays with us for a pretty long time. And then the management, the case management, the follow-up, the contact tracing will fall back on, especially at the local level, at the district disease surveillance and notification officers to the state epidemiologists. They have garnered enough, at this point, enough capacity, and they would also need more to continue to continue the response. So in terms of movement across states, each state will now have direct view over what exactly is happening in their states. Of course, with still technical partners from the NCDC, from the Federal Ministry of Health, will be able to support each state to build capacity on their own going forward. Because it was an emergency, but at the stabilization phase, we should build across board a lot of capacity for us to move on eventually.
Thank you so much. Dr. Ayo Oluwole is a public health physician. Thank you for sharing this.
Thank you, Doctor.
Now, it's just a little over 100 days since the COVID-19 entered into Nigeria, and 12,486 is the total number of the infections confirmed in the country, with 3,959 recoveries and 354 deaths recorded according to the Nigeria Center for Disease Control, NCDC. This leaves the number of active cases across the country at 8,173 after testing 78,244 samples nationwide. A breakdown by regions shows that Lagos State in the southwest remains the epicenter of the epidemic in the country, with a total of 5,767 cases. Next is Kano in the northwest. With 999 cases, it has recorded 48 deaths and discharged 450 people. The Federal Capital Territory leads in the north central with 952 cases. Its active cases are 664 after discharging 265 patients. Edo leads in the south-south with 401 cases. It has discharged 109. Borno tops the northeast with 356. And while total confirmed cases in Ebonyi top in the southeast is 103 cases so far. And despite the increasing number of COVID-19 cases in Nigeria, there are still some people who think this is child's play. But one of the almost 4,000 discharged COVID-19 patients in the country joins us via Skype from Abuja to share with us how real coronavirus is, his experience with the virus, and how he survived. Damilare Ojo is a legal practitioner and a COVID-19 survivor. Thank you for joining us, Dami.
Hi. Good evening.
Dami, talk us through your journey. How did you contract the virus?
To be honest, I really don't know how I contacted the virus. I still try to remember or know how, because I can't remember coming in contact with anyone that confirmed COVID-19. So I really don't know how. Really don't know.
So when the symptoms started, what was it like for you? Were you confused or what?
Yeah, I was very confused, really. Because, I mean, the symptoms were just like malaria symptoms, really. And I just went to do a test. And then from doing a test for malaria, I found out that, I don't have any malaria parasite, neither was it typhoid. So based on that, I just went to do the COVID test, based on the way I felt, and there was no malaria symptoms. And that was it. And that was when I realized that, I actually was positive to COVID when they told me the results.
There are some people who say it's difficult getting that test done. Was it that easy to get the COVID test done? Was it a regular hospital you went to, or you went to a specialized center?
Well, apparently in FCT here, they have collection centers. So I went to one of the collection centers in the exhibition pavilion, and it was quite straightforward, to be honest. There was no issue at all. I booked an appointment the next day. They sent me a form to fill. I responded, they evaluated and called me up for a test barely 2 hours after. And I did the test, and that was it.
So when you got your test result, was that when you went into the isolation center immediately?
Yes, I went there the next day after I got my test results, which was on my own request because the public health VFCT team were ready to pick me up, but then I had to defer to the next day to get my mind together to move to the isolation center.
Why did you have to, as you said, get your mind together? What do you mean?
Because it was a lot of things to process, because I was one of those who never believed the virus existed. So it was strange for me to, accept it and then resolve to go to the center because I was in doubt as to what the government was going to offer at the center, So that was what really took me a lot of time to think about.
What was it like when you got to the isolation center?
Well, it was against my imagination, to be sincere. I was at the Gwagwalada Isolation Center precisely, and I think the service there was indeed fantastic and commendable. They were good. The welfare for members of the patients that were at the center was quite fantastic. Feeding, medications, the way all the doctors were behaving, to the patients. There was no stigmatization. We're always being encouraged, and it was quite a fantastic experience at the isolation center in Gwagwalada.
Okay, well, tell us what you think about the response of the government and what can we do to help others who are still in doubt to understand that this is real?
So firstly, as the regular Nigerian was in doubt as to what the government was going to do, I was impressed from when they came to pick me up from my house, to when they fumigated my house without me asking. They disinfected my car. They contact traced every single person whose contact I provided, did COVID tests for them. All of them, their test result is out now. The contact tracing team also came up to my house subsequently to follow up, with my neighbors and myself after I was discharged. The welfare at the center was fantastic. I think the government deserves a bit of credit for the good deeds with regards to my situation, and the response which I got was quite impressive.
When you say quite impressive, going forward, now the numbers seem to be increasing and then the lockdown is easing. So the country is basically opening up. Yes, there are certain conditions that have been given for people, for instance, wearing your mask constantly, washing of hands and social distancing. What should be done to ensure that Nigerians begin to imbibe this rules and follow them through to minimize the spread of this virus?
It's really for people to understand that this virus is real and is really ravaging the system. We might have to live by it. We just need to keep up with regular health precautions. Personally, I intend going on personal advocacy, across the nation to various sub-regions in the nation via similar means that we're having this conversation now, enlightening the people, going on radio. Personally, I'm going to take on that to advocate, and I'm calling on other people who want to join me on this to let, if Nigeria is ours, and we need to build it ourselves, and, we need to all come together, even all recovered patients. Let's begin to sensitize people as much as we can about the effects of this virus in our system. It's really terrible, and a lot of people don't know that. So I'm taking on advocacy personally to do that.
Thank you very much. Damilare Ojo is a legal practitioner and a COVID-19 survivor. Thank you for sharing your thoughts and your evening with us. Now, the compliance level to the guidelines for COVID-19 prevention is abysmally poor in open markets in Lagos. The use of the face mask, the level of hygienic handling of food, and lack of social distancing are some of the issues that are glaring when one goes into the market. But many stem from having started relaxing their minds, and consequently their health is at risk. In our next report, we'll look at the situation in the market with our correspondent Olu Phillips.
As have been seen since the presidential task force on COVID-19 started, the provisions of most of its guidelines have always allowed state government to apply those as suits their peculiarities. As part of the guidelines to open the economy, and in this case for markets, the Lagos state government announced some measures for compliance. 1. Compulsory wearing of face masks in public places. 2. Provision of hand-washing facility or the option of hand-based sanitizers. 3. Social distancing. And 4. but not the least, healthy handling of food items and goods. So we set out to monitor the level of compliance at some markets in Lagos. The open markets are almost back to business as usual. Food items are in open display, poor hygiene, and handling of items and foods with bare hands. This is one of the reasons why face masks have been recommended. Watch this young man interaction and how he suddenly sneezes into the air with no precautions. To a bit of a more organized and gated environment, the Computer Village, owing to its controlled associations, have ensured some level of compliance. They've talked to their members, but argue it may be difficult to control the sea of heads milling around the market. We can only enforce compliance when people come to our shops, they say.
We advise our business people, our colleagues, to change the style of their workers, maybe shifting. Some of them on shifting basis. They don't come every day because we advise them not to sack anybody.
Save for a reduced number of days of opening, nothing suggests any social distancing on the streets, at the banks, at the markets, and nearly all public places have been thrown into life as it was in the beginning. Some even argue just open the entire system, as nothing seemed to have been restrictive with the partial ease down.
If you want to give us 3 days, you give us food day. If you want to give us 5 days, you give us food day. This half day is not helping us at all.
Whatever it takes to really combat the pandemic still remains the superior argument. Olu Phillips, Channels Television News.
Well, Olu Phillips is at this point at the Computer Village, where he had gone to earlier to report on the situation there. But he's back in that area now. Olu, what do you find on ground? Olu,
Auntie, good evening. It's good to really understand how we got where we are. Remember, on this program, we started when this program was debuting and taking all the numbers from 20 to 30. Today, we have it in over the excess of 10,000. Yes, over 3,000 people have been discharged. But again, that has raised up a lot of issues, including those of the fact that we now are dealing with a public health issue. We're dealing with compliance level, and we're dealing with how people are beginning to understand and cope with the diseases, with the virus as it were, especially when it comes to opening the economy, which is what the market like Computer Village represents. For instance, for over 6 weeks during the lockdown, this market, with other markets, were shut down, and when eventually the lockdown, this market saw itself reopening, having with some precautions, asking its members to get face masks for customers, asking its members to have sanitizers, and making sure that they have limited number of staff in the place. But again, to me, which is not in that report, is the fact that having lost a lot of money in the 6 weeks they were down or didn't operate, and government not providing any sort of grant, that it doesn't make any sense for them to begin to action by way of new kind of levies, which has been imposed, they say allegedly imposed on them by a newly installed traditional market leader they call Iyaloja. That for them is not acceptable if, for instance, they pay all their taxes to Lagos State, pay their taxes to federal government and all of that, considering again that they are losing a lot of time since they only trade Monday, Wednesdays and Friday. Why the extra imposition in this COVID era is the biggest question coming out from this market when I visited earlier.
Thank you very much, Oluf, and do stay safe as you return from that location. But let's go on to Bayelsa State, where our correspondent, Deborah Timiwood, also visited the market and now gives us an update. Deborah.
There's a conversation that's ongoing in Bayelsa State among small business owners. They're asking the Bayelsa State government, why are they still placed on a ban from engaging in commercial activities? Why those traders that have their stores at the various markets in the state are allowed to trade freely? These entrepreneurs are saying that their resources are depleting.
In a shop like this, it will not contain more than 2 or 3 customers that will come in. But look at market that people full. Well, they have to consider some of these things. More especially this Mjama Road. This is where we are getting our daily bread. And then when we get home now, we will not tell our children that our shops are closed.
No, we have been waiting for, we have been feeling that maybe for a long time they could have asked us to open. But since that time, getting to 2 months now, we locked down. We've been finding it very hard to feed our family now, because this is the only source we have. We are not government workers that we earn salary. We only feed our family from here.
We spoke with the Permanent Secretary of the Ministry of Information in Bayelsa State regarding why some entrepreneurs in the state have been told not to engage in commercial activities while others are trading freely. According to him, those at the market are flouting government's directive and they will be penalized.
Small business owners who are not selling food or pharmaceuticals or other essentials were asked to, they could use the frontage of their houses to sell their wares, you understand? So that at least they could keep body and soul together. That arrangements was made for them. That you don't necessarily have to be in your shop to sell. But there are certain commodities that we agree that must be in the stores to sell. But we also need to consider the fact that people need to be alive. People need to stay alive, to stay healthy before they can do business.
The entrepreneurs are also calling on the Bayelsa state government to provide palliatives to cushion the effect of the coronavirus. From Yenagoa, Dobra, Timiwood, for COVID-19 updates.
And still ahead on the program, we'll go over to the United Kingdom to find out what the situation is like over there and how Nigerians there are seeing the response in Nigeria to COVID-19. We'll be doing that in a moment. Do stay with us. Thank you for staying with us. Now, the cities in Europe are gradually opening up. Businesses are returning, and in places like France, for instance, restaurants are allowing the sit-outs in front of their restaurants to open up and for people to sit down, but they must observe social distancing and still wear their mask. In the United Kingdom, for instance, quarantine for travelers is also they've started enforcing that as well. But let's go on to the U.S. In New York City, in the United States, has begun the first phase of reopening. But we'll be getting more from our correspondent in Washington, Maria Bird, who will be telling us what the situation is like there. Maria? Okay. While we'll wait to hear from Maria, New York City began the first phase of its reopening parts. That means that as many as 400,000 workers can begin returning to construction jobs, manufacturing sites, and retail stores. This comes as the U.S. continues its march towards reopening the economy, despite the states like Texas and Florida are still seeing increases in new infections. Meanwhile, many countries in Europe are experiencing a drop in the number of cases and COVID-19 death tolls.
It's the start of the first phase of easing lockdown measures in New York, and New Yorkers were quite anxious to get back to work. More than 205,000 people have been infected with COVID-19 in the city, and nearly 22,000 people have died. Across the United States, the death toll has surpassed 110,000 as officials worry about a second wave of COVID-19 outbreak that could be coupled with the protests across the country over George Floyd's death. Over in Russia, plans are also underway to ease coronavirus restrictions currently in place, despite a stubbornly high number of new cases in the city each day, around 2,000 per day for the past fortnight. As of this afternoon, London hospitals had not recorded any COVID-19 deaths among those who tested positive for coronavirus over 24 hours. However, across the UK, a further 55 people have died after testing positive for coronavirus during the same period. Meanwhile, the country today began the compulsory 14-day quarantine for travellers. In New Zealand, Prime Minister Jacinda Ardern declared there are no active cases of COVID-19 in the country, saying she did a little dance when she found out.
Today there are no active cases in New Zealand. We have tested almost 40,000 people for COVID-19 in the past 17 days and none have tested positive. We have had no one in hospital for COVID-19 for 12 days. It's been 40 days since the last case of community transmission, 22 days since that person finished their self-isolation. And so today, I can announce that Cabinet has agreed we will now move to level 1 to get our economy fully open again, and we will start almost immediately. We move down to COVID-19 alert level 1 from midnight tonight.
And in South Africa, children returned to schools as the government continued to ease what was one of the world's strictest lockdowns. Initially, only pupils in grades 7 and 12 would have returned to class, with other years phased gradually. The reopening had been delayed after teaching unions said schools lacked sufficient health and hygiene measures.
While that is happening in Europe and the United Kingdom, for instance, Europe is opening up, and in the UK, travelers are going to be quarantined for 14 days. Nigeria has introduced some guidelines towards opening up again the economy. But let's look at those interim guidelines. They capture the classification of patients, diagnosis, management of complications, and discharge criteria for COVID-19 infections. But let's focus on the discharge criteria for COVID-19 patients. According to this new guidelines, the symptomatic patients should be discharged by the managing clinician 10 days after symptom onset, plus at least 3 days without symptoms. Now, that is for patients, symptomatic patients, discharged by the managing physician 10 days after symptom onset, plus at least 3 days without symptoms. Now, while the asymptomatic patients, asymptomatic patients should be discharged from the COVID-19 pathway 14 days after the initial positive result as the date of the collection of sample. Also note that a negative laboratory test is no longer required to discharge a COVID-19 patient. Let's go on to the WHO website and find out there is no cure yet for COVID-19, but supportive management of cases involved. First, the latest guide on the website of the Nigeria Center for Disease Control, as the agency continues to work closely with states setting up treatment centers, training health workers to manage COVID-19 patients to recovery. The World Health Organization also has the latest updates on the global response to the COVID-19 strategy. Their website guides the public health response at national and sub-national levels. And our website, channelstv.com, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. Thank you for watching. I'm Neota Igbe.